a lot of people and a lot of agencies, unfortunately, advertise for these rotations or clinical experiences where students have to pay money depending on the rotation. And then they do that for the sake of having letters of recommendation from America, right? And for the match, for those who don't know, letters of recommendation, we are required to submit 3 to 4 letters of recommendation. And the rule of thumb is that if the letter of recommendation is from America, it's better than a letter of recommendation outside of America, even if it's a chair of department elsewhere in the world. Yeah, that's what we know as
Huh.
IMGs. Because again, this is their system and that's how he built it. And I can't be against or with, but I signed up for this. So I would just go with whatever they're asking for.
Hello, everyone. This is Dr. Moss from Life as a Patient Doctor. I am very excited to interview Dr. Ahmad, who is an Egyptian, has lived in 3 continents, 6 countries, and awarded his MD degree from Zhejiang University, which is part of the top 3 medical schools in China. He also served as the president of the International Students Union, which has 150 members serving 6K international students. He matched into Rosalind Franklin University Internal Medicine at Northwestern Hospital. He's an advocate for mental well-being in communities where it's deemed shameful, and also the well-being of IMGs, international medical graduates, who are pursuing, similar to him, the U.S. medical path. Thank you so much for being here.
Thank you for having me, Dr. Moss. Welcome, everyone.
I am so glad that we met. We met actually at orientation. We both got to the same residency. I want to hear more about your background and journey into medicine.
Hello again, Dr. Moss. Thank you for having me today. And yeah, I remember although it was one small talk in between the breaks, but then we talked for 2 hours afterwards. What drove my journey into medicine? I'm actually a first generation doctor, not only in the family, but in the extended family that goes back to uncles and aunts. My family background is all different kinds of business, real estate, engineering, all these kinds of stuff. So I enjoy doing a lot of stuff outside of medicine. Maybe what the ignition for me into exploring medicine early on, that I had a personal injury that made me stay in the hospital for a month. That was 15 years ago. I was young at that point. And the whole family started calling me Dr. Ahmed, like here and there, my late grandma. That was fun. I remember on my Instagram page, I posted something 10 years ago that I wanted to go into medicine. Well, 10 years later, I lived up to my word. And here I am matching at my dream program.
I love that. It's really amazing how not having a family in medicine can still inspire you to go against the grain. I don't have anyone in medicine and it's possible. So it's really good to hear. Even international, it can still be done.
Yeah, certainly. Maybe the challenge for us, the thing that we share as we are the first generation doctor in medicine, especially in the school I went to, Zhejiang University, a school I have utmost respect for. We have a lot of people pursuing the medical path in the US. I have a firm belief that in any field in life, not only in medicine, but if you have seniors and people who experience in the field you are pursuing, they make your lives 100 times easier. Sometimes like something pops up in the middle of the night, you don't know what to do. It could be a simple homework or a final exam that is coming tomorrow. That 1 or 2 tip can change your whole life and direct you towards whatever you need to do. Maybe that's something we lack as first generation doctors. It could be more challenging as we didn't have people going into or pursuing the medical path from my school. I'm the third person in my school who matched into America, and the history of the school, or at least the International School of Medicine, has been there for 30 years now. But the school itself is more than 120 years old. I talked to my seniors, like those 2 seniors who graduated. Thankfully, after I matched, I get consults and calls every few days from people in the school and from China in general who are eager and motivated to pursue this path. So that's something that I'm proud of, among other things. That would be one of the closest things to my heart.
I love that. It's so important, like you said, to pass on the knowledge from that struggle. It's not always from successes that we learn our lesson. Being able to pass on to the future generation is so meaningful for sure.
Yeah.
Something you said caught my attention. You were Egyptian and then you went to China and then you went to US. I'm so interested speaking the different languages, how different languages, different cultures. Like, how did that work being able to bounce throughout your education and
Um,
assimilating with the language?
the English language, we don't need to talk much about it because you see it everywhere. But
Mm,
until high school, we did not really learn proper English. We do not deal with each other in English. It's mostly Arabic, but just the academic English that you need to pass your exams, but not really to have daily conversations or running your life, basically. But it all stems from the personal interest to the languages. And it depends on the person. If you're someone who's interested in exploring new stuff, enjoying other cultures. That's one of the things I like to do when I go to a new country. It's a common practice for me at this point. I lived in 4 Arab countries. We all share the same language, but the accent is way different. In some of those countries, to blend in, you have to speak the accent. Otherwise, you'd be deemed as the outsider, not in a negative way, but if you want to get the full experience, and that's what I'm looking for. If I want to go to a country, I don't want to live as the foreigner who's staying with his foreign bubble and not enjoying his life. Maybe this concept is a bit different in America because the community is built this way. You're not an outsider if you are coming from any country in the world because they have these small communities. You can go to the same workplace and find people from all of these different ethnicities and backgrounds. Maybe that's the coolest. And there would be no different look, I would say, coming from an outsider community. You just need to blend in by understanding the history of the place that you're in, knowing about the different culture. That could be music culture, news culture, political culture, anything that will relate you to the place. And that's something I'd like to do. And obviously throughout my medical school, my medical education was all in English. So that made life easier, particularly for China. This was all before China. And I was able to graduate a semester before my medical school started. I didn't want to wait this time. And I went ahead to China and studied Chinese language before we start. To that is for me to have that culture shock early on before getting into medicine so that I'm very comfortable when I start medicine and I can actually tell people what to do, what to avoid. You have plenty of time because you're just learning a language. And Chinese is one of these languages that require you to love it so it can love you back. So for the first 2 years in China, I barely use translation. I always use dictionary. We have to memorize a lot of characters. So whenever I see a character that I don't recognize, I just start drawing it basically on my phone. And then through the dictionary, I would just understand like how can we pronounce this? When can we use it? Common sentences and things like that. It was out of love to the and respect to the language more than just I have to learn this so I can move on with my studies. So maybe that was the difference.
I'm seeing some analogy with medicine here of learning medicine, like learning a new language.
Actually, that also goes on in other aspects of life. You have to love what you do, so you do what you love. It's no fun to understand all of these biochemical pathways. If you understand everything in pathology and pathology and histology, when you have to dissect under the microscope, no, it's not fun for a normal human being. But we're medical students, we're medical students and
Right.
graduates.
Yeah, it's
So
not fun for everyone.
you have you
Especially.
have you have to find the joy.
Oh, yes, very much. Especially like you said, and all of those histology, pathology slides, unless you're going to be a histologist or a pathologist, it is definitely a challenge.
I have so much respect for these people. I just can't keep up with it.
Yes. Okay. So then, oh, that makes more sense by going to China, by if that you did it all in English, that makes more sense. So then, what motivated you to go from China to the US for residency?
For us in China, the postgraduate path in China is a little bit different. Usually, you'll have to be dealing with patients in Chinese, and you have to live in China afterwards. They would to compare between Chinese and the medical system in the US. And I think the field is more open in America because in China, you cannot get into residency. It's more of a master's degree that you have to pursue. And then after that master's degree, you have to take another Chinese exam and then another medical exam. And the career aspiration and moving on with your career in China for foreigners is not as promising as it is in America. Here, you have the knowledge, you have the clinical trials, you have the resources. China has crazy resources. I was in a school that has over 10 hospitals. 3 of them are among the top 10 hospitals in China. So yeah, we have a lot of resources too as medical students, but as a graduate, my personal path did not align with how it is in China.
Okay, that makes more sense. When you're in medical school in China, do you really get set on more of a specific type of residency? Do most people go into primary care, or you can still do any apply to any specialty?
So it's not a residency, it's master's degree, and you can apply to
Mm.
any master's degree that you want. Most of them are, they pay you to do like you can, they have a lot of scholarships for foreigners. But what comes after that, very few people actually do that. And I think for us as international medical graduates, most of us have English educational background. And if you want to continue this path, countries like America, UK, Australia, and Ireland, their native language is English, and that's what the science language is. If you go to PubMed, you wouldn't see an article in any language other than English, and not that other languages or countries like do not have the knowledge, but it's just common sense that we as MDs or DOs, we are somewhat scientists. You have to keep up with reading papers, you have to keep up with the knowledge and the latest advances in medicine, and it's going to make life much easier if you are practicing English and reading in English.
That makes sense. And it sounds like it would be an additional barrier for
Mhm,
IMGs if they don't have a strong English background.
mhm.
'Cause I've always wondered that if the step one exam is translated to other languages, or you have to take it in English. Can
Yeah.
you talk a little bit about the requirements for
Yeah.
IMGs getting into medicine in the US?
Okay. So for step one and step two exams, they're all in English. I think because it's self-explanatory, really, because it's the United States medical license exam. It has to be in English. But the challenge for us in for step one and step two exams, as because our IMGs, especially those who are coming from China, we incorporate subject-based medicine, not system-based medicine. Meaning is that when I study physiology as a whole, all the systems of physiology, pathology, the same idea, pharmacology, the same idea. While in many medical schools in America, and actually some of the schools back home too, they use the module system or the system-based learning. Today we have nephrology. We're going to learn everything about nephrology. So what makes it more challenging for us is that we have to make that integration our own. You have to understand the basic anatomy because you said anatomy as a whole, but not the specific anatomy of each system. So you have to align all of this knowledge that you gathered during the first 2 or 3 years of medicine and have this integration. So I always tell people that even if you're not taking the steps, in order to have an amazing integration, not for the exam, but for your knowledge as a future physician, you need to read first aid, which is the Bible for step one, because it makes life easier when it comes to this test. You read the whole system, like cover to cover. You understand all aspects about this systems, the anatomy, physiology, pathophysiology, pathology, pharmacology, and everything else.
Such a good point, and it is something relatively in the US medical system that they have pretty much all the medical schools have really based it to systems based.
Mhm.
Because I'm just thinking if you spend all your time learning pharmacology, it's harder to just memorize those things versus understanding them in relation to the body. So that makes sense. And also that's how step is tested that is
Exactly.
a patient presents. A patient's not going to present with just needing a medicine. Like you need to understand the medicine in context of the body, in context of all these other areas. So that's interesting. And that is helpful to know of is an additional that IMGs have to go through. What other things do all these IMGs that are contacting you? What are other questions that they usually pose to you?
So other than the steps, because again, because many people in China do not apply or pursue the medical path, they always have, not all of them, but many of them used to have at least. And I was one of them, that USMLEs are a dream. That is not something you can do because it's very hard. It's the most difficult exam ever. And, as you just start studying, it's a bit hard. It's really overwhelming in the beginning, but it becomes easier as you proceed. I think the funny thing is that when I finished step one and I was starting to study for step two, I thought that about step two too, because I was not getting questions right. And I was like, what is happening? Am I lacking behind? But It's just a process. Maybe that's the word that maybe I use every day with everyone. Everything is just a process. You don't need to understand everything. No one understands everything the first look. You have to spend some time. You have to sleep on it. Have all different kinds of resources, questions, podcasts. Thank you for that. Videos and whatnot. So this is maybe for us, this is the first and most important barrier to medical students is the exams. What comes after that is the process of applying to the match and what do you need to apply to the match in America. So, because the match itself is a process that is streamlined, I would say, is the same for everyone. But we have to work on our CVs, and it depends on the specialty that you are willing to apply for. If someone who is an IMG willing to apply for a more competitive specialty, again, it will be deemed impossible until proven otherwise. I've seen examples who were able to overcome that, but they wouldn't be able to if they didn't pull off something that is, in my opinion, very magnificent. When you see someone like publishing 100 papers, more than that, and when you come to American people who graduated from here and they know the process, they also go through this. But we just like did not imagine that this is possible to do during medical school. So maybe the work around the CV, which is also unique to each and every one of us, because everyone have their own background and experiences, personal struggles and professional struggles. Maybe something that we face as IMGs, and I believe one of the most challenging barriers to on our CV is the clinical experience that we get here in America. We all understand it's a different country, different culture, different currency, and that is highlighted especially for those who come from third world countries, I would say, or that's how they call it. I don't like this nomenclature, but well, this is just for audience to be able to understand the point. The currency exchange and the way or the amount of money that we need to spend in order to come here. And even if we have that, even if we have that means, IMGs are taken advantage of for the most part when it comes to this. Not from the hospitals, not from certain doctors. I'm not pointing fingers, but just there are yeah, but when you go to, let's say you're an IMG and you're done with your SIPs, and that was me at some point last year. Okay, I want to look for a clinical experience here. They call it USCE, which is US clinical experience, or I'm looking for a rotation here. Want to know the system. I want to be familiar. Most of the programs, if not require clinical experience in the US, they prefer clinical experience in the US. And it's totally understood because basically, if you come here, you're able to understand, you're able to use the EPIC, which is brilliant medical recording system. If you have, that's a big bonus in your CV. You need to understand the patient population. Are you able to talk to patients in the US? Are you able to understand and blend in the culture? Are you able to live there? Because yeah, people can have all of these theoretical knowledge. They end up not able to blend in because they just don't like it. And this is valid. Not everyone is not one cup fits all, as they call it. No, it's just how flexible and able are you to live in totally different community. Maybe we know a lot about the US because of the movies and the news and the songs, right? That's all about what we know. If you don't visit the US, it's different. It's just different. You'll have that culture shock. You'll have to deal with a lot of stuff. I had a friend of mine who just graduated from the school. Whenever I ask him a question that is naive for people in America, they're like, I'm just chill. That is America. Okay, okay, now I understand. No worries. We don't need to go down this path. So these are the reasons for the clinical experience in the US. They find it hard. Why? Because a lot of people and a lot of agencies, unfortunately, advertise for these rotations or clinical experiences where students have to pay money depending on the rotation. And then they do that for the sake of having letters of recommendation from America, right? And for the match, for those who don't know, letters of recommendation, we are required to submit 3 to 4 letters of recommendation. And the rule of thumb is that if the letter of recommendation is from America, is better than a letter of recommendation outside of America, even if it's a chair of department elsewhere in the world. Yeah, that's what we know as
Huh.
IMGs. Because again, this is their system and that's how he built it. And I can't be against or with, but I signed up for this. So I would just go with whatever they're asking for.
It's part of the system, part of the
Yes,
culture.
exactly. Exactly. So people struggle to get into this point. So I need a little recommendation, especially if I'm close to the match. I need to go there, spend a month or 2 or 3, whatever. Even people spend 2 weeks to get a recommendation. A lot of wild stories out there. And I didn't like with this 2 week or 1 week part, that's when people are taking advantage of. We'll take you, we'll bring you here. You have to spend some money. You won't have real contact with or real rotation basically, but you're just like sticking around to get that letter of recommendation. And the problem is once you're here, let's say you did everything, you paid your dues and you just arrived and your family are depending on that and they're proud of you. And you reach there to that hospital or clinic or office and you end up finding this is not a real thing. Like nothing is happening here, or I'm not having hands-on experience. I'm not having any sort of experience. I'm only seeing one patient a day. I'm not even able to see the chart because of HIPAA violation. But then for HIPAA, usually like many of the programs that I respect, they require you to have HIPAA training before going for rotation. So this is one of the things that can help, but not all programs do that. So once the student is here and he is on the spot and he already paid for accommodation and he has a flight back home to keep up with his documents and he saw that it's not a real thing, what should they do? Nothing. You should just comply and stick there for a while to get your letter of recommendation and end up on a good note. Because this, you get only one shot. For many students, you get only one shot. You don't have the time nor the means to continue in doing that. And this is an umbrella term, I would say. I can't overgeneralize that over institutions or schools, but it happens. It happens and we see it and it's sad. You see some one of these advertising rotations, they bring 30 or 40 students at once, and then they write them all that generic letter of recommendation that does not take you anywhere. But the thing is, that's your CV, and you have to fill your CV, and you already paid for it, so you can't really ask for a refund. So maybe that is one of the biggest stressors in our path as IMGs. I think it's even more than the exams themselves because the exams are just like theoretical. You study, you take the exam, you pass. If it's good, then great. If it's not, you work on the other aspects of your CV. But for this is basically a bidding that you're doing. You're not sure if it's gonna work or not. That's maybe the tough part of it.
I'm hearing from what you're saying is really a hidden curriculum in order to just get the bare minimum letters
Mhm.
of clinical experience. That is something that we do take for granted as part of our medical education here in the US. And you're saying that people have to pay for it, pay for like an away rotation. It's in a different country, but away rotation. But if you're now going to an away rotation where they don't even give you access to the EMR, it sounds like there are all these different barriers. I'm just taken aback of all these things that are just constantly in the way for these individuals. And I'm just also thinking the power dynamic differentials of already in medicine as medical students versus residents and attendings. There's this power dynamic of medical students stay silent, they listen, they do what they're told. And then you add in this additional barrier of being from a different country, having a different language. I can't imagine the struggle.
Maybe it's something I also forgot, which is it's funny, but it's not that funny because we had a friend in my program. They wanted to apply for the visa. I know of someone, a friend of a friend, who matched in one of the programs last year, and I think it was one of the Ivy League programs, and they applied for the visa from their home country, the J1 visa, which is the visa that we hold as IMGs here, and they got their visa denied. Simply as that. After going through all of that process, I couldn't even imagine that happened. But it really does happen to after the match. Before the match, we have to apply for another kind of visa in order to go for clinical rotations. And I myself had to travel to another country to apply for a visa because I got my first visa denied too. Yeah.
You've already been accepted for a job that is almost impossible to get, even if you're from the US, just taken away. Wow, that's horrendous.
So again, this is the system. This is what we signed up for. Is not flowers or roses. I understand that the struggle is real for medical graduates in the US, even to get into medical school. In a sense that will all of that in mind. I know it may sound that bad, but up until this point, I feel privileged to be in this position. I just needed to say that out loud so people are able to understand the struggles of everyone. We all share struggles of different sorts. So maybe it's a point of understanding and appreciating each other to get to this point.
Yes, I couldn't have said it better myself. That is literally the motivation for really this podcast is to talk about these barriers, these stigmas, these things that we don't want to talk about because it's maybe deemed by society as negative or less than. And the reality is we all struggle different, whether that's health conditions, struggling with failure in exams, struggling with being able to even afford to get to apply. You mentioned something early on of being a part of all these different cultures. And I'm wondering if going through all this, if you have an idea how it will help you as a doctor, being able to connect with patients, especially like you said in the US, we have people from all over the world, a lot of different cultures. How do you think that your background and your unique journey will help you as a physician?
So again, I would go back to the point that I feel privileged to reach this point, since that I've been exposed to people from all over the world. Whenever I go out with friends and then I tell them, oh yeah, I have friends from this country, he taught me this word or taught me about this kind of food. It's fun when you are all over the place when it comes to this. I almost don't struggle when trying to find a common language with a patient. And it's very rewarding when it comes to this. When you are able to see a patient or to pick up a lead that no one else would have picked up. Sometimes if a patient who are able to speak Mandarin as native language, and then I threw like some Chinese word, they'll be like, oh wow, how are you able to do that?
Wow,
And
yes.
you
You're
know,
especially being able to like really people don't expect you to be able to speak their language.
exactly. And I remember being in a rotation here with an amazing doctor. He does not speak Spanish, but because many of his patients do speak Spanish, he was able to conduct whole conversation in Spanish just to reassure the patient. It's the best feeling ever. And I aspire, I was like, what the minute I said, I aspire to be like you. You know what? You're just the best. These tiny things. There's a saying that they say, if you talk to someone with a language they understand, it reaches their mind. But if you speak with someone with a language they speak, it reaches their heart. So maybe that would be the silver lining between both. Or maybe because that's maybe a privilege that we both share here as first generation doctors in our families. We must have been exposed to all different experiences in life other than medicine. So we're not a medically dedicated family, and it's not terrible. It's not a bad thing per se, but I'm privileged to be able to talk about technology, engineering, or politics, real estate, anything that you can talk about. You can just find the common language with everyone. And that's the fun of it. Like that's when people like the eye opening for them. Like, you're not just another geek, they're a doctor who only cares about, yeah.
Yeah,
So
it's
maybe
really
that's
showing humanity.
exactly. That'll be the fun part.
I love that. That is such a good point that I don't think if we talk to anyone else of having a background outside of medicine and being able to connect with the patient because most likely our patients are not in medicine. Being able to just find some connection and commonality. Like you say, it teaches their heart, it connects with their heart, and you can really form a better patient doctor relationship, which can have huge benefits for them being able to follow your recommendations or them be able to trust you. There's so many positive attributes. Dr. Ahmed, as we start to wrap up this episode, are there any, I like to call them pearls of wisdom or other advice to other medical students or future health professionals that are having those struggles, whether that is struggling with the IMG process, struggling with health conditions, just struggling with medicine? Do you have any words for
Yeah. I love to use this quote. It's an Arabic quote. I'll just say it in Arabic and then translate it real quick. لا تحقرن صغيرة إن الجبال من الحصى. Don't belittle trivial things. Mountains are made of rock. We are not superhuman. Since we're medicine, we may call ourselves superhuman. We may have this ego, but we're just human beings. If you ever feel down, if you ever feel that you need to talk to someone, you don't have to know everything. You're not supposed to know everything. Reach out to people, reach out. I said that in many podcasts, to be honest. Always have a psychological outlet or a mental outlet for you. Don't give up on your hobbies, things that you like to do. Make sure to have your support system of family, friends, seniors, people who can help you. don't be afraid to ask and don't be ashamed to ask. And if you feel like you cannot take this anymore, or you need to really talk to someone and you are stressed about the process, talk about it and find people who can help you. Because if you leave it in, it will eventually burst, and that's not going to be nice. Yes, I'm one of those people who believe that, especially while studying for the steps, do not give away on studying like for a month or two. Try to study a new thing every day. That's why I always like to have different resources, these flashcards, questions, podcast videos. You have all kinds of resources online. Everything is available. So try to rotate among these. Always have your mind rolling, and always ask questions, but do not overwhelm yourself. The whole path here in America and everywhere else in the world is a process. So just trust the process. Believe in yourself, and it will happen. Take your time. And even if you fail first time, we don't want you, no one wants you to fail, but even if you do, that does not define you. So take care of yourself. And I'm not sure later on in residency how available I'm going to be, but I usually don't leave messages and texts beyond 2 or 3 days. I'm not sure if this thing are going to change, but I respond to everyone. So feel free to reach out to me personally, Dr. Moss. She's a great resource for us as students and now graduates, telling people about their experiences. We know that we're not left alone. We know that some people went through this process. I wanted to share this personally to tell you that you're not alone in this process, and eventually you will make it, and everyone will be proud of you.
Yeah, that's beautiful. I love also you said that trust the process. Everyone is different. Like you said, everyone doesn't know everything. If there was people who knew everything, there wouldn't be this beautiful variety of different types of professions and different types of doctors. There's a reason for everything. Thank you, Dr. Ahmed, so much for sharing your journey. And I like to end up with just giving a summary of what you said, because you said so many amazing things. So
Yeah.
I'll try to do a small summary. But you said about going through so many different countries throughout your education, and you decide to pursue medicine in China. And with the knowledge that China was a very different culture and different language, you went out before medical school to get a taste of what it was like, what it was to live, to really assimilate as much as you could, and even tried to learn the language. And then you did your medical journey in China in English, though, and there were so many different routes that you chose to apply for the US residency, and it wasn't an easy thing. It was challenging, but you made it through as one of a handful of people who've been able to ever do it. And you provided some really great advice to future IMGs and also for individuals like me who have not gone through that process, and really can educate us to know these are the challenges that our fellow classmates or colleagues have dealt with, to really help them through that process. Not just the cultural simulation you're talking about, taking and going to clinicals where you might not even have access to anything. In addition to being in a completely new culture, language, there's a lot of culture shock that can possibly have. Talking about changing currencies, there's different power dynamics, a lot of hidden curriculum you talked about, which I thought was really helpful to see from that perspective. You also talked about going through all these life challenges, how it'll be helpful while talking to patients, because you're able to form that connection, that break those barriers through being able to communicate with them, speak their own language. I love what you said, but teaches their hearts, not their brain. Touch their heart and be able to form that trusting relationship with patients. And you finished up by providing advice that mountains are made of rocks. They're all human. You're not supposed to know everything, nor are you supposed to have everything. It is okay to struggle. It's okay to have mental health. It's okay to have a life outside of medicine. And it's important and helpful to be able to do other things like hobbies, have friends. In order to be successful, you need to reach out to your community and let them know when you're struggling, because together, that's how you're able to succeed. Thank you so much for sharing your journey. And I know you mentioned connecting with you. So, how can other IMGs or other individuals reach out or get in contact with you? What is the best way for them to do that?
So I am available on my X account, my Instagram account, my LinkedIn account. You can find me out on all of them with my name, Ahmad Abdel Khalik. If you can just write it down. Thank you, Dr. Mas. On Insta, it's going to be ahmad.m.l. And the handle for X is ahmad, not E underscore M underscore L. So odds are you'll just find me. This is a long, not very common name. So always reach out. I'll be there. My DMs are always open for you.
Thank you so much. I'll make sure to link them below and they'll also be in the captions so people can make sure that they get in contact. Wonderful. Thank you so much. And unfortunately, you're going to be in the other hospital, but I'll see you whenever we connect with the because I'm in psychiatry, you're in IM, but there are two IM groups. So whenever we come together, I know we do groups, IM psych groups all together. So I'll make sure I'll see you in person in a couple months.
Yeah,
And then and then, of course, if anyone wants to get in contact with me, all of my social medias are at medpsychmoss. You can get resources on my website, medpsychmoss.com, where I share resources for pre-medical students, medical students, and residents. I actually created a blog post from our orientation on how to be best teachers, how we can better support our medical students so they can be future doctors. And so check those out. And I hope we might collaborate to see if I can update my residency application workbook blog to be more IMG friendly because I don't have that experience, but you do. So we'll might have to do a joint blog post on that to help others. Thank you, everyone. And I thank you again. And I'll see you all next time. Take care.